information here on the charts with the heart rate. Adjust this to adjust that. Perfect. Okay. Now to wake them carefully and just give them a quick checkup. Hello there. Hello there. Hello there. Hi. I do apologize for waking you at such a late hour in the evening, but I am Nurse Luna. Do you know or recognize where you are at right now? Yeah, it can be a bit confusing, I understand. Welcome to Dream City Clinic. You are here at our overnight special recovery clinic. It's about 2 a.m. for you, if that's okay. Yes. Do you remember why or how you were admitted here? Okay. You are just feeling under the weather, and that's about it. That's okay. Thank you so much for getting yourself checked in, because your health is our number one priority, okay? I'm going to perform something known as a head-to-toe exam. I'm going to check your vitals and everything that is quite up close and relative towards what you came in here for, okay? I don't like to waste any time, so let's jump right into it. I'm first going to get a medical glove, if that's okay. Good. Are you allergic to any types of gloves or medical medicines, etc.? Not that you know of, okay. Let me get one glove on. And how are you feeling right now? You do seem a bit tired. Yes, okay. A lot of people find the head-to-toe exam to be quite relaxing. So if you do find yourself falling asleep, feel free to. But I'm going to ask you to be awake for a couple of things, okay? So, just looking at your chart here, and everything seems to be okay. May I check your forehead first? Good. I'm just going to put a bit of pressure on your forehead. How are you feeling? Okay. Okay, and then right there. Okay. A bit of a question here. Do you know what day it is? Okay. And I did tell you earlier. Do you know about what time it is? Okay. And what is your name? And how do you spell it? We look at your recovery sheet. Yes. And birthday? Yes. What sign does that make you? I always ask everyone. Good. Now I'm going to feel your lymph nodes, if that's okay with you. Good. Just going to put a bit of pressure right here and right here. It's just along the jawline, okay? Let me know if that feels uncomfortable or if you're feeling pressure, okay? Good. That appears to be a bit of pressure. Could you, if you could you swallow for me? Good. Yeah, that seems to be a bit painful. Yeah. So, your lymph nodes have a lot of pressure. I'm going to move on just to test your eyes really carefully, okay? And before we continue, how is the medical bed that we have put you in? You are currently in one of our rooms here in Dream City Clinic, as we did need to watch you overnight and to supersede to the next day. Are you enjoying the background that we have? And would you need more pillows, blankets, perhaps a cup of tea, or perhaps a salt water rinse? Okay, and are you quite cold? Are you warm? Typically these hospitals and clinics are quite cold, so if you do need, we have these wonderful electric like heating pads where you can turn the dial to whatever heat you'd like. Would you like us to bring one in for you? Perfect. Okay. I'm going to ask you carefully now to continue with the exam. I do have to do this for you. Are you able to see the Snellen's chart that's right behind me? I do have a couple of letters that are right behind me, as it is just about a meter away from you, which is exactly what we test, okay? And can you read line number 1 for me? What letter or word does that say right there? That says E. Very good. I'm going to move on down now. Are you able to read line 4 for me? Highlighting it here. Okay, and what does that appear to be at? What are the letters? L, B, E, D. Okay. Are you able to read line 11 for me? Typically that's where most people are unable to read past, but can you identify the letters for me? That's okay. Thank you. I'm going to continue now with taking a bit of your vitals, okay? So you are hooked up to one of our EKG machines, which is constantly checking your heart rate and your blood pressure, but I'm going to manually check that myself, okay? So, what I'm going to do is, if you'd allow me to, I'm going to put this just around your arm, whichever you choose, left or right? Left or right? Okay, good. And I'm going to just add a little bit of pressure right into your arm, and we're going to feel and calculate your blood pressure, okay? Good. Okay, is that comfortable? Good. So, what I'm going to do now is I'm going to look at the heart rate. We're going to calculate the pressure together. So, I'm going to just add a bit of air. Let me know if it's uncomfortable, okay? Good. So I'm just going to read the gauge. Okay, looks like it's calibrating. Looking good. Okay. Yeah, now I feel the resistance. And are you feeling okay? Good. Blood pressure appears to be quite good and relative. Okay, I'm going to release the pressure now. Just going to twist and good. Thank you so much for allowing me to do that. I'm going to take this off your arm now. So your blood pressure was at the perfect number. 180/70, which is perfect for you. Good. Going to set that down now. Okay. And I'm going to now use a light, a pen light. I'm going to take a look at your eyes and inside your mouth, if that's okay with you. Good. I do see your heart rate is quite well, so what we're going to do is we're going to just open a depressor really quickly, and we're going to calculate and look right to your mouth, okay? Good. Just going to open that up. Good. I'm going to get my pen light here. Switching to the other eye now. I'm going to cover this eye right there. I'm going to ask you the exact same questions. Can you see the light? Okay, and has your eye or perhaps your vision been impaired from the light shining at you? Perfect. Thank you. Now what I'm going to do is I'm going to look at each eye. We're going to look into your retinas. Okay, so first going to just maneuver this eye. Could you look at me? Good. And can you visibly see the light? Good. And is it quite bright or is it okay? Too bright? Let's just turn the light a little bit. Is that better? Good. It looks like that's more perfect there. Good. Lift it up. Could you look up for me? Look up here. Good. And could you look down for me? Look down there. Perfect. Look back at my nose. Perfect. Going to switch into the other eye now, which I'm just going to carefully lower. Good. I'm going to ask you, are you able to see the light? Good. And is it quite bright or is it normal? Good. I'm going to ask you, could you look up for me? Good. And look down. Marvelous. Could you look back up again? Good. And look down. Good. Look back at me. Good. Now I'm going to look right into your mouth. And I know that this is the part that you arrived. It was a bit uncomfortable. Was that true? Yes, I do remember catching a fever in one of the documents here. Open. Yes, I do see that. Okay, and can you just do this for me? Good, keep doing that. Okay, and you can relax. Now I'm just going to do one more time and look at your mouth. Open your mouth one more time. And can you just close your jaw as best as you can? Yeah, that does seem to be a bit irritated, so I do see we are looking at a case of tonsillitis, if it's okay with you. I'm going to take a quick sample of that, if that's okay with you. Good. Just one more time, open your mouth. I'm just going to get just a bit of the sample from the sides of your cheeks in your mouth. Good. We're going to send that in, and we might need to do something later if we find out something, okay? Good, I'm going to send that in. Now what I'm going to do is I'm going to give you two things here. A bit of medicine. First, we're going to give you something for a bit of the irritation. This is a nasal application. So, it's going to put a little bit of the calming medicine just to the nose, okay? So, I'll let you know when to just breathe in with your nose and breathe out with your mouth, okay? So, let's just shake that up a little bit. Okay, now breathe in and breathe out. Good. One more time. Breathe in. Good. And breathe out. Perfect. Other side. Breathe in. Good. And breathe out. One more time. Breathe in and breathe out. Marvelous. Perfect. Do you feel that working almost immediately? Marvelous. That's exactly what I was looking for. And now I'm going to give you just something that is going to help quite a lot of the irritation and upset feeling that you may have next to your teeth and to the back right here next to your tonsils. We're going to give you just a little bit of a drop of something that's going to help with that, okay? And it tastes exactly like oranges. It's quite nice. Okay, now just say ah. 1, 2, 3, 4, 5. Okay, and can you just swish, swish, swish that everywhere along the teeth, along the back of the throat, exactly, and then just consume the medicine as you usually would. Perfect. A lot of people like it. It tastes quite literally like a Laffy Taffy or like an orange type of candy. It's quite nice. I was about to say caffeine because I'm a little bit tired. Okay, are you feeling a bit better now? Good. What sinuses, which I'm actually going to take one more look at with my light. Funny enough, if you put a light in your forehead, you can see to your sinuses here and there. I'm going to take a look at your forehead and cheeks and take a look into your sinuses, if that's okay with you. Good. Good. Put that right down your forehead. Relax. Yes, it does appear to be a bit irritated. Okay, now onto each side along the nose. Right there. It looks like, again, a bit irritated. And to the other side. Okay, and again, a bit irritated. Good to know. Thank you. These are just things I have to write down and assess when I do write my report for you, because we make a very specific medical exam for you. Good. Now we actually have something on your finger already, which is a finger monitor, which is going to measure your heart rate and the consistent amount of heart rate that you have. I'm going to remove that from you for a second. Okay, and it looks like a little bit like a finger brace if you've ever used one before. But what it does is we wrap it around your finger like so, and that's how we've been tracking your blood pressure, a little bit of that, your blood oxygen level, and we've been tracking your heart rate through this. What I'm going to do now is I'm going to replace it with the other one I have onto the other hand. So switching one with the other. And if you can give me your other hand. Thank you. And I'm just going to apply this onto the other finger, okay? So give me your hand. Good. I'm just going to. Perfect. And can you move your hand like this for me? Good. Perfect. Now that that is already settled and assessed, how are your hands feeling? Okay? Good. And are you able to move your arms like this for me very carefully? Just move your hands like any way possible. Good. Looks like the movement's good. I'm just going to squeeze your shoulders, okay? And can you feel that? Good. Now I'm just going to squeeze your hands, okay? I'm just going to. Good. And can you shake my hand as firm as possible? It's not going to hurt me. Good. And the other side. Good. Very good. Now I'm going to feel just a little bit at your abdomen, if that's okay with you. Good. I'm going to put just a bit of pressure right at the stomach. And are you feeling okay? Have you been feeling a general wellness with your stomach? Or have you ever had an upset stomach recently, in the past maybe 2 weeks or so? You're okay? Good. And any pain when I apply pressure? Good. None. Perfect. That's good. What we like to hear. Okay. Now I'm going to look at your knees, particularly the bending of your knees. Are you able to bend the knee? Yes, please. Could you just bend either knee for me? Yes, just like so. Perfect. And the other one. Perfect. And now, if you could just maneuver your toes like so. I just need to see that there's movement. Perfect. That looks good. Great. You can relax now. No more exercise. Now I'm going to quickly double check your temperature, as when you arrived you did have a fever. Relax a little bit, okay? Just going to. Marvelous. It looks like your temperature has lowered from before. One more time. Perfect. So it looks like that we are operating at a lower body temperature than prior. When you arrived, we were looking at a fever, and now we are looking at a low grade fever. And what that is, it's right a little bit above the normal temperature that we would have expected from our average temperature, basal temperature. But right now, that is wonderful. That means that the properties that we're looking for are being perfectly measured to help you. That's good. Now what I'm going to do is I'm going to ask you to do a couple of focusing tests with your eyes, if that's okay with you. I do have a yellow little pen here, and I have a blue little pen here. Are you able to identify the difference? Okay. Perfect. I'm going to ask you to focus on one, either the blue or the yellow. Let me know which one you focus on. Yes, let me know anywhere below. Just let me know which one you're following on, the blue or the yellow, okay? And do not get distracted by the other one, but just keep focusing on it, okay? sometimes when we're in a state of feeling a bit unwell, we can lessen the ability of our eyes working to focus, which is okay, but it's good that we keep you on track and keep you happy and make sure that everything is good. So keep focusing on the one that you are focusing on. Which one was it again? Let me know. Yellow or the blue? Good. Perfect. Great. Marvelous. Good. Okay. Now switch your focus to the other one. Which one are you looking at second? The blue or the yellow? Let me know. I'm going to do it again. Now focus only on the one that I told you to pay attention to, okay? Not the other one. Do not switch your focus. Good. Perfect. Good. Marvelous. Now I'm going to ask you which one in your peripheral vision is closer, the blue one or the yellow one. Let's begin. Which one's closer, blue or yellow? And now which one's closer, blue or yellow? Which one's closer, blue or yellow? And which one's closer, blue or yellow? Good. And what about now, blue or yellow? And what about now? Perfect. Okay. And a visual difference test. Let me know which one gets out of your peripheral vision first, the blue one or the yellow one. Let's begin. Which one? Blue. Perfect. Which one, blue or yellow? 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 The both. Perfect. That's exactly what I was looking for. And which one, blue or yellow? Perfect. Both of them. Or yellow would have been appropriate. And what about now, blue or yellow? Good. And what about now, blue or yellow? Good. That's a good quality. It looks like we're looking at that perfectly. Now, what we're going to do is I'm going to send a little bit of these samples we took into our laboratory to have them searched. I'm going to show you really carefully what we do. So, some of us will actually use a little assembly like this. We're going to get a little bit of these samples that we took, and we're going to put them on a small little, it's kind of like a petri dish type thing, and we are going to assess cellularly what could be the problem that is giving you a bit of the sickness that you're feeling, okay? And we are going to assess multiple times with different magnification settings, and we're going to take a quick look right inside of the sample to assess what's correct and incorrect with the perhaps bacteria that's going on to affect you, okay? Good. Very glad that you are understanding this quite well. Have you ever used one of these before? Perhaps in a science class or a science lab. This is exactly what we still use in medicine nowadays in order to pay attention and double, triple, and quadruple check any type of bacteria or virus that could be affecting you, okay? So we still use these. And what I'm going to do is I'm now going to reapply a bit of a bandage right there. And I'm going to just double check one more time to make sure that everything's okay before I do leave and let you rest for the rest of the night, okay? any rash or bruising. Perfect. Same with the abdomen and the legs and the feet. Perfect. So, looks like you're doing as good as we possibly can right now. We're going to investigate further, especially in the laboratories, okay? And I'm going to see you soon, possibly in the morning, with something that we might do in order to get a bit of the fever down and to help you feel 100% again, okay? Again, I am Nurse Luna. I will be working the entire time during the night. If you need me again with that remote, if you could hand that remote back to me. Good. If you hit this button right in the center